Welcome to the Blue Dot, Northern Kentucky's premier political podcast, brought to you by the Kenton County Democratic Executive Committee. Welcome back to the Blue Dot podcast, where we talk about the kitchen table topics that matter most to those in our community. And one of the topics that is consistently cited as the most important is healthcare. So on this episode, we're going to tackle some of the most prominent concerns. I'm Natalie MacDonald.
And I'm Brian Koehl. Today, we'll be joined by Dr. Chris Bolling, who has spent over 35 years in pediatric medicine and is the chair of the Obesity Task Force as part of the Kentucky chapter of the American Academy of Pediatrics. Dr. Bolling has been featured in national media discussing pediatric health topics such as obesity, nutrition, and healthy lifestyles for children, and has spent time in Frankfurt discussing public health and dispelling the myths surrounding transgender care.
Yeah, Dr. Bolling is absolutely brilliant and beloved by his patients and families, and I can't wait to talk to him today. But first, let's touch on just a few of the healthcare issues that are facing those in the Bluegrass and beyond.
Yeah, we've talked a lot about the negative impacts of the current administration's policies, most notably that without bipartisan action, 100,000 Kentuckians are about to see their healthcare premiums double. 35 rural hospitals are at risk of closing, and Kentucky healthcare facilities like the University of Louisville Health have already started canceling projects and cutting services and staff because of massive cuts to Medicaid.
Yeah, and I think people are starting to get the message here. I think that more and more people are understanding what all of this means. So we're certainly seeing that these issues are a primary concern for Americans all across the country. But one thing that we haven't talked about in depth on the Blue Dot is the attack on science and medicine, and how it not only sets a dangerous precedent, but it also puts millions of lives at risk. From the Make America Healthy Again platform to vaccine hesitancy and a reclassification of healthcare professionals, the medical field and the science field is really getting hit hard.
Yeah, we've entered an era where science and medicine is being discredited by people who are not trained or qualified, and questioned by people who believe their Google searches make them experts.
Absolutely. Well, neither one of us are trained or qualified. But the good news is, instead of looking to Google, we look to the experts. And today we're honored to be joined by Dr. Chris Bolling to address some of these issues from a medical perspective.
Stated earlier, Dr. Chris Bolling has over 35 years of experience in pediatric medicine, and I'm pretty sure many of our listeners entrusted him with their family's care. Actually, our three boys went to see Dr. Bolling, and we are more than honored, Chris, to have you share your experience. Welcome to the Blue Dot podcast.
Thanks a lot, Brian and Natalie. I'm honored to be here.
Yeah, thanks so much for being here. And we did give a little introduction to you at the beginning of the podcast, but it'd be great if you could tell us a little bit about you and what you've been focused on lately.
Sure. So, I'm a native Northern Kentuckian, as we were talking about. My family's kind of from all over the place, but I grew up my entire life in Northern Kentucky, a Taylor Mill native, and wound up coming back to do general pediatrics practice in Northern Kentucky and loved it. Loved every minute of it. It was really fun seeing families, watching kids grow up. I had great partners, left behind a great practice where I retired from about 3 years ago. I also had sort of a mid-career thing that I did. I think I've told you guys both about this, where I went over to Children's for about 3 years. I had sort of this leftover thing that I had done after pediatric residency, where I was really interested in pediatric nutrition and fitness. And I went back to Children's and trained up in pediatric obesity when I was there. So I did a lot of that when I went back to my practice after 3 years at Children's, 3.5 years at Children's. And I continue to do that. So in retirement, in fact, today I was just working on a book that I'm working on with a colleague from San Diego on how to treat pediatric obesity in your office. I got to be on a writing group through the American Academy of Pediatrics a couple of years ago, and we're doing a how-to book for pediatricians right now. So it's fun.
Oh, that sounds great.
Yeah, that's a lot of fun. It's a lot of fun. Keeps you current too.
So in the writing group, do you share writing responsibilities? Because that's something that I've often thought about, but I could just see myself having writer's block 99% of the time.
And I think I had writer's block for like 9 months, Brian. It finally feels like it's starting to flow. I have a really good author, the primary author. Her name's Natalie Muth, and she's from San Diego, and she's written a couple of books. So when she asked me, I thought, oh, this is a great way to kind of do it, because she can kind of show me the ropes, how to do the citations, how to do the structure things, etc. So
Oh, that's great. That's great.
Fun.
Well, on the healthcare front, it seems that healthcare is, I mean, really being attacked from all over, right? From Medicare cuts, rising insurance premiums, equitable access to care and research being gutted. And with all this chaos and the rise of MAHA, aka Make America Healthy Again, I know it's a tough question. What do you see as the biggest challenges we are facing right now?
Boy, I don't even know where to begin sometimes,
Right.
Brian. It's like, that old flood the zone thing that they did in the beginning of
Exactly.
this term. It's just like there's an attack on so many different levels. I really honestly am, there are so many things that I'm worried about. But I think the most clear and present danger is some of the stuff that's going on with vaccines at this point.
Mhm.
Immunizations are really under attack. And I think it's not going to take long. People act like, oh, we won't see anything for a while. I'm like, no, we'll see things pretty quickly.
Yes.
And we'll see effects of this, of the lies that are being kind of put out there by the administration, by RFK Jr. We'll see some effects of that. And we're already seeing effects of it. Uh,
Yeah, we just saw Natalie and I were just talking prior to you jumping on that CDC's measles cases right now, as of I think it was last Tuesday, 1,912 this year versus 285 in 24 and 59 in 23. So that is a 14,000% increase year over year in measles cases.
Yeah, it's going to come back quickly. Some of the ones that I think people don't understand too is like when we start quitting some of the other vaccinations, I think, and once you start sowing doubt, the other vaccination rates start coming down. There are some where you don't have to worry about measles coming back into the community. They're already there. Things like H flu and pneumococcal vaccines, those are against bacteria that we all have in our respiratory tract. So it's not like we have to wait for an index case to come back in and break through. They're going to
Yeah.
happen right away when people quit vaccinating. And I think we're going to see a lot of that. Yeah, it's very disturbing. There were 3 deaths from whooping cough this year in Kentucky already, and those are all 3 were in kids who were not vaccinated.
Yeah, and I think I read that in Kentucky leads all states in the number of whooping cough deaths, which is
Well,
really.
actually, I think Louisiana has us on that.
Oh, do they? Okay.
Louisiana had an outbreak. The new second in command at CDC, who's been appointed, was the Surgeon General in Louisiana. He was placed in the number 2 position very quietly, but he was someone who was not encouraging vaccination, was not making Louisiana pediatricians aware of the outbreak. And they had lots of cases in Louisiana, lots of hospitalizations as well.
And when you say there's other ones, so I've heard a lot about Hep B as well. And I think maybe you could speak to the misunderstanding of how it's transmitted. And prior to there being a birth dose, there were screening procedures set in place, but those failed, right? We still had a really high number of cases, even though they had screening procedures without the vaccine. So I don't know if you could speak to that a little bit.
There's a lot of cherry picking with what this administration talks about with vaccine policy. They'll say like, oh, that there are other countries like Denmark that doesn't do routine hepatitis B vaccinations. And look, their rates are no higher than ours. Well, Denmark also has universal health care and they have excellent
Mhm.
screening. We tried the screening approach. We really tried that, but we're a very complicated health system. We have a lot of disparities across the country. Most people do not know their status. We don't do the screening like some places do. So we tried the only give if you screen. I remember those years. And it was a very conscious decision. Like, we're still seeing lots of cases of hepatocellular carcinoma, so liver cancer, and hepatitis B illness itself, which can also be very serious. So the decision was made to universally vaccinate to try to bring down the viral burden on the society, and it worked. We wound up with just a fraction of the number of cases of hepatitis B that we used to have. So, do kids get it through maternal transmission? They absolutely do. Can they get it through other sources? Yes, they can. It is not just a sexually transmitted disease, as the White House said, yet they should wait till age 12. I'm like, we tried that. That doesn't work in the United States. And what we have seen has been a real decrease in hepatitis B and liver cancer.
Mhm.
So, it's hard to fight these battles all the time about, oh, look at this other country. That's apples and oranges. we got into the same battle. I know, we've talked before about the transgender healthcare stuff that, they constantly will bring up other countries that really are not a good fit for what goes on here. So at any rate, not a good comparison, but that's what's going on with hepatitis B currently.
Mm.
Is we really are going to see increased rates of hepatitis B if we don't do universal immunization.
Yeah, the anti-vaxxers is just something that's always, I guess, fascinated is the word. I've always been intrigued with that mindset and what's behind that. I've actually tried to do a little research and find something that's not a 150-page book on it that I could try to get some background on it. I don't know if you have any insight into that cultural driving or the medical or what's behind that or
You
any
know,
views from your experience.
Yeah, the author that I always go to, who's got some great stuff on the anti-vaccine movement, is Paul Offit. He is from
Okay.
Children's Hospital of Philadelphia. He's got a whole series, and I can give that list to you guys of
That'd be great.
some of his books. He does a really, really nice job. Paul Offit, Offitt, and he's just really very articulate. He also gets death threats and all sorts of stuff. So yeah, he has some really great stuff on that, Brian, if you're ever interested.
Yeah, I will definitely take a look at that recommendation. And then we were talking again previously before we jumped on the pod about the black box warning on the COVID vaccine that just came out, and I was not familiar with that. You and Natalie had a quick talk about it. Could you kind of bring us up to speed on what you know about that and what a black box warning is and what that means?
Sure, sure. So those of us in medicine are very familiar with black box warnings. So the FDA will put a black box warning on a medication because whenever you start a medication, you always want to talk about side effects and what you need to be
Mhm.
watchful of and et cetera. What are contraindications? And a black box warning is put on a medication if it's got a serious confirmed side effect that you need to be aware of. I mentioned to Natalie, like the one that we're both familiar with is when I had a patient with anxiety or depression, we would maybe start an SSRI, things like Paxil, Prozac. And we would always tell those come with a black box warning that they've been linked with suicidal ideation. Well, that, launches a discussion about what does that really mean? What are the risk side effects? Someone with depression, you worry about suicide anyway. So these black box warnings are serious side effects that are documented. What happened with the COVID vaccine? This is coming from a man named Vinay Prasad, who is at the FDA. He was a colleague with Marty Makary, who is the director of FDA currently. And so Prasad actually left the organization. I think he got Laura Lumered at one point and was forced out. And then Makary brought him back in. He was popular because he was very much opposed to the COVID vaccine years ago. He's never been a big fan of the COVID vaccine. And this black box warning got issued because he said FDA staff found 10 cases of deaths from the COVID vaccine. Now, even if that's true, I mean, certainly a black box warning, if that's true, that's appropriate because, you do a cost, you do benefit analysis, you talk with families like this is a possibility, but COVID itself is dangerous, et cetera. But what it's turned out, and what I've read recently, there's been a good expose in the New York Times about this, that Prasad jumped the gun on this black box warning, that his
Mm.
FDA staff of these 10 deaths, they ruled 3 of them out that were not related to the COVID vaccine. Another 4 of them were likely not. The remaining 3 were possibilities because they were temporarily related. So he really jumped his own staff on that one. I think catching them off guard. I think we're going to find out more about that as time goes by. I'm not seeing another follow up on it yet, but it was consistent with his pattern of wanting to get COVID vaccines less into he's got something against them, and he is sort of creating this narrative to discourage their use, in my opinion.
Yeah, it's so unfortunate. I think that people are trying to educate themselves, which is a good thing, but also you can't go to Dr. Google either. There's so much that goes into research. There's so much that goes into these vaccines. The mRNA technology has been around for years. So it's the reason why we do those black box warnings, right? Is because if there is something so that you can go to your doctor and
About it.
and talk about it, right?
Well, it's interesting you bring that up. Like where do you go first for information? Well, interesting thing is happening right now because the CDC, I don't think is as trustworthy anymore.
Right.
So, they've always been this bulwark about where you get your good information. And what we're finding is a lot of state health departments saying, like, we're not going to follow the CDC. We're going to follow guidance from the professional organizations, from the American Academy of Pediatrics, from the American College of Physicians, from the American Association of Academy of Family Practitioners. So, that it's really become incumbent on those places. There's a great website if you're ever looking for good immunization information that's really solid and evidence-based. University of Minnesota, called CID Wrap. They do a great service in kind of keeping people up to date on what's going on. And they've taken over a lot of the information pieces that CDC we used to depend on. But CID Wrap has really been a great resource.
Awesome. Well, we're going to have to make sure that we get this out to everybody so that they can find these references. But we talked a lot about vaccine hesitancy, and that's only one real component of the Make America Healthy Again campaign. And I think there probably are some good concepts in there. The proactive and preventative health promotion, school lunches, nutrition. But I also remember when Michelle Obama tried to do this with her Let's Move campaign, and it was targeted as an overreach. How do you think we can kind of take the good out of this and promote maybe some of these good ideas that are in that Make America Healthy campaign?
There's a lot of what they say that there is to like there. And I remember too the pushback about the nanny state. Remember that argument with Michelle Obama's efforts?
Yeah.
So, do we all think that corn policy needs to be resolved and we need to figure out what to do with high fructose corn syrup rather than jamming it into foods? Do we want to get away from ultra processed foods? Do we want to eat healthy? Do we want our kids? I mean, that's what I spend my life doing. I'm writing a book on it. That's my thing. The problem is MAHA, out of one side of their mouth, talks about these things and gives them some sound, and that's wonderful. But they're also right behind cutting all research on that stuff. So really finding out more, really diving deep in there, really enacting good policy. I don't see the interest in doing that. They talk a good game. I'm not seeing concrete actions, honestly, in that front. And they're running up against some of the things that Michelle Obama's Let's Move campaign ran up against, a lot of industry pushback. And it really creates some interesting dynamics in that party, because some of their biggest donors, are major owners of these corporations. So there's a real dichotomy here. It's going to be interesting to see how it plays out. I don't think let me put it a different way. I think there's a lot that has to play out, because I think there are a lot of people whose interests are very aligned very differently in the administration currently.
Yeah, for sure. And when you talk about picking and choosing what they're going to cut too, we could talk about one thing. We could talk about NIH grants, but then we can talk about also regulations in our environment, which have
Correct.
just been completely gone. And you talk about asthma, everything that causes disease from the environment is just, they're not even paying attention to.
And that's very important. They're worried about aluminum adjuvants in vaccines, but what about, smelters and environmental exposures, which far exceed. Anyway, yeah, it doesn't make any sense.
Yeah, with the NIH grants, I do want to talk about that a little bit because it is near and dear to my heart. I've spent the last 23 years in pharmaceutical clinical research, and 1,400 or more grants have been cut, billions of dollars in research funding. We're seeing HIV and dementia research and cancer research that are being cut. And I wanted to get your reaction on how you feel that this is going to affect us in the future. Can we recover from this? Because I think every day that we lose a day in research is the day that we're falling farther and farther behind on finding cures for people.
I think you're as well versed in this, probably better than I am, Natalie. I think it's going to take a generation to pull it back, because you know how those studies go. They take a long time to get through. And you hear these things too, like we have done so much and spent so much time debunking the autism vaccine connection that just doesn't exist. And now we're, being told that we need to go back and that they want to fund to do those studies over again, or do them in a different way and do them as randomized controlled trials, which, that another one, like vaccine research is with a vaccine that it's effective. You can't ethically do a randomized controlled trial on measles vaccine. That's unethical because we know it works and we know it's effective. So yeah, I think we're going to lose a lot of time, and I don't know how much. I don't know. What's your opinion? I think it's going to be a generation.
Yeah, I agree. And I think the other thing is the data that we are collecting is now being skewed as well. For instance, I know people might not know this, but when you conduct a clinical research, you collect demographic data. At least that is the goal. For Alzheimer's, for instance, you have a higher incidence of Alzheimer's in Hispanics and in the Black population. So they want to collect that data. Universities lost their funding if they collected that data because that was considered DEI. So all of that, even the data that we're collecting isn't going to be right. So let's just say we have 4 years of this. How far that's going to set us back is, I guess, well, that'll be left to be seen.
We're seeing that a lot in a lot of areas of pediatric research as well, that you just are not allowed. It's like denying that disparities actually exist.
Yeah.
And we know that our kids of color and our kids in lower socioeconomic groups are Appalachian families. They suffer disproportionately from all sorts of things. And then suddenly that's not allowed to be studied anymore.
Yeah, with this conversation, it's just making me think of the incompetence, which I've been actually happy about the incompetence when it comes to like the Trump administration, because these people are evil.
Exactly.
Just think if they were competent, how bad a shape we're in, but they're incompetent. But when this incompetence spills out into science and healthcare and medicine, I mean, the consequences already are and will continue to be, unfortunately, tragic until we can turn this around. And hopefully it won't be another 4 years, Natalie, because if we have a good 2026 midterm and we take control of the House and the Senate, maybe some of these programs can get reinitiated. But again, the time we've lost, you won't be able to make that up overnight, just as you both have stated. Well, Chris, you're an advocate for public health in general. And how do you think we can overcome the misinformation and distrust that's been sown in the general public so that we can really begin to make meaningful process again? I mean, once we can kind of get past this, or how do we combat it while it's underway? Is there anything we can do? What are you doing on your fronts? What are your groups doing?
I've got to the point too with certain groups. I think we all have to speak up in our lane. I know people don't want to hear about what my politics are, but when it comes down to hepatitis B vaccines, I feel like that's my lane. I feel like I owe it to say something about that with my friend groups and other places even. I don't want to be obnoxious. We're in the holidays, right? So it's like nobody wants to hear about that stuff. But and you don't want to be the cranky uncle. I think when you stay in your lane and speak to your own truth, Stephen, my husband, has a really close friend group, and we were in Nashville, and she is a trans child. And we were having a difficulty with another one of his friend group who has a gender fluid child as well. And Stephen's friend said to me, she said, I thought this was just wisdom. She said, you know what? She said, you didn't say anything wrong when you were kind of saying something different to her. You were being yourself. You're speaking to what you know. And I think that's really important for physicians on these topics to be speaking out on it. Not that we have to be shrill or anything, but I do think we do need to speak up when it goes into our areas that are really, people are in danger because of it.
Love that perspective. We had our military month last month where we talked to a lieutenant colonel and a lieutenant general about the national security risks. And that was kind of their perspective too, that's their lane, and it's hard, especially in their profession, because they are supposed to be pretty politically neutral. But once they get out of that, really being able to speak up and use their voice and their expertise to highlight what's going on. So I think your perspective from the medical field, it really makes sense to it's just truth. And you're just speaking the truth on that.
Well, it's got to be a grassroots effort. So
it does.
We can speak, as you said, from our own kind of expert positions, or at least our lived experience, and if you speak with passion and clarity and try to maintain civility, hopefully those messages will start getting through.
And boy, I've messed it up so many times. Even with patients, and it pains me sometimes. When I'm like, I read something very wrong. I thought, oh, there's certainly all they need to hear is me say, you really need to get this. I'm like, oh no, they were very much going anti-vax on me, and I didn't read it right. And these are very uncomfortable conversations. And so you pull back a lot of times, but I do think that you just kind of get back up and go, just try to speak the truth. It's hard.
Yeah.
You touched a little bit on the transgender issues, and I know this isn't your specialty, but I've heard you speak before about dispelling the myths of transgender care, specifically in youth. And as you know, Governor Beshear vetoed several bills that were banning or tried to ban gender affirming health care and other just basically cruel legislation built on false information. But if you could dispel just a couple of those top more harmful myths,
Well,
I'd love to hear your perspective on that.
you're right. I'm not a transgender medicine specialist. I'm a general pediatrician. But so over a course of about 30 years, I had probably 24 kids who persistently identified as transgender. So you guys know my practice, like several
Hmm.
doctors, you know, 14 doctors, several nurse practitioners, several PAs. So big practice. And we're talking 24 kids over a 30-year course, not very many. And these are kids who had persistent, like kids who, like over time, really consistently said it. It wasn't a phase, it wasn't anything else. They definitely identified differently. And so those kids, we knew those kids, they were our patients. So this was all happening right as I was retiring. And there were a lot of threats coming to institutions that delivered gender affirming care
Mm.
that they were scared to speak up. And so the local chapters of the American Academy of Pediatrics, both in Kentucky and Ohio, were like, we need somebody who can speak to this. And so I'm like, okay, I think I can speak to this. We've been through the advocacy wars and how to, what you say and what you don't say. So I sort of got drafted into the position. So I got to testify twice in Frankfurt and twice in Columbus. And there's so much misinformation out there. Like they have there's a very specific group of people that fly around and they're very much on point. And they've gotten the message out that gender affirming care means medications, means surgery on really young kids. And that has not at all been the experience of any of my colleagues with gender affirming care. For us, gender affirming care means you give the kids space and time, you talk it through, you don't do anything that causes lasting changes until they're able to really understand what that means. I've never, ever seen surgery done under the age of 18. And you heard all these things like, oh, this person got that, this person got that. Well, people can take their daughter to a plastic surgeon for breast augmentation under age 18. And
Yes.
people can do those things, but good transgender medical clinics do not do that. Children's Hospital does not do surgery on children under age 18. And the other medications of these 24 kids that I mentioned, most of them didn't have any medications. Maybe 4 of them had the puberty blockers. Maybe 1 of them received testosterone or estrogen to fit their gender identity before age 18, maybe 1, but they had to be all the way through puberty. And then you heard all these crazy things about the medications. So, number one, gender affirming care did not, to me as a pediatrician, did not mean medication or surgery. It meant counseling and giving the kids time to talk about it, not denying their experience, but affirming that what they're feeling is real and seeing if it sticks.
Mhm.
And then the medications, like people were calling them chemical castration and this other stuff. The medication, these so-called puberty blockers, they've been around since the early 90s. They were a revolution for kids who had what's called precocious puberty. There's some enzymatic defects where kids will get, they'll go through puberty too soon because they have like a testosterone producing tumor or a series of events where they get too much testosterone and they go through puberty at age 6. Well, you have to delay it. Otherwise, they're going to be, they're going to go through puberty at age 6 and they're going to be 3.5 feet tall. So these medications have been used for that circumstance. Are there side effects? Of course, there are side effects with everything. But you go through that with families, just like we were talking about before with the black box warnings. You go through those things and talk about what this means, and you do it very thoughtfully. And you give it in order to like delay things to give the families and the kids time to process. Because it's really, if we go through puberty, some of that is not recoverable. And these medications really are considered completely reversible. You hear people say they're irreversible. I'm like, they're reversible. Now the cross-sex hormones, as they call them, giving it estrogen or testosterone, those are what endocrinologists will say are partially reversible. So there are some side effects from those, some effects, not even side effects, but some effects from those that you need to be really sure of what's going on before you initiate those things. And those are done, like I say, after many, many, many visits and lots and lots of getting both parents on board and getting everybody comfortable with it, having the child assent. Never done quickly or under duress in my experience at all, or any of my colleagues' experiences. The other thing too is like you hear all these crazy things. Like when you really get drilled down to the root of the issue is I don't think that a lot of these people think that being transgender is a thing. When you really start drilling down with them and you hear what some of the things they say, they sort of expose themselves as feeling like, I don't really think it's a thing. I
Right.
remember one legislator in the state of Ohio said on the floor of the Senate, not that your sex was assigned at birth. She said, your sex is determined at the moment of conception. If you are X sex or XY, that is where your sex and gender is assigned. That's what God intends you to be. Well, that doesn't really fit because some people aren't XX and some people aren't X or XY. They're XXY or they're XO, meaning they have only one X chromosome, or they have androgen insensitivity, meaning that their organs do not respond to the effects of testosterone. So you can have an XY person come out looking exactly like a girl, develop exactly like a girl, only know that she's got XY when she doesn't go through puberty because she doesn't have a uterus. But she's a girl
Mm.
in every way. She looks like a girl. She's developed like a female because her organs don't respond to testosterone. So it's much more complicated than I think state legislators can figure out, but they certainly have opinions on it.
I think it's just a way it's the uncertainty and to be able to inject fear and raise concerns to people that it's somewhat of a ruse of how they're using it when they state policy is like, one of the things they say is no transgender males in female sports is like one of their top national policy concerns. And to your point, the transgender population is like what 0.5% or something of the entire population. So it's tragic. And again, innocent people who need help and support get hurt. And that's just what we keep seeing over and over again.
Gee, I am not a big fan of Ross Douthat on the New York Times. However,
I struggle with Ross.
he had a really good on his Interesting Times podcast. Chase Strangio, who argued the case, the Skermetti case from Tennessee in front of the Supreme Court, was his guest. And Chase Strangio did a fantastic job in that
Oh,
podcast. If you're ever looking for something to go through that, and I thought his description was, like people talked about like it's strategically the wrong time to go take this to the Supreme Court. They shouldn't have taken it. And Strangio made the comment like, these are people's lives. He said, you don't get to pick exactly when you bring this forward. We chose to fight for this family. These are families. This is some of the hardest stuff I've seen families deal with. They don't know how to deal with this. And the last people who should be sticking their nose in this really difficult, intimate family decisions are state legislators who don't know what they're talking about. Why they
yeah.
feel obligated to inject themselves there, it's maddening.
Yeah. Politicians in the exam rooms, right?
Wrong place,
What could possibly go wrong?
wrong place for them. Let
Yeah.
families and physicians figure it out because it's hard. It is
Yeah.
really difficult.
Yeah, they
Yeah.
made it like the hallmark of all of their campaigns. It's every commercial they're talking about it. It's nonstop. And it kind of makes me think of this quote from Wicked when Elphaba says they need someone to be evil so they can be good. And I think it's real. They
Yeah.
have to find somebody to target so that they can look good. But these are people who
Yep.
aren't doing anything wrong,
Nope.
regardless of how you feel about it. Unless you sit down and you talk with someone or you know the medicine or the genetics behind it, then just stop the hate.
And
Yeah.
that's what animated me going to Frankfurt and Columbus, Natalie, was just like, I know these families and I know what
Yeah.
they're going through. I'm doing this for them. I mean, I got accused by one of the Kentucky state legislators because I made a point. I said, you start doing things like this, you're really going to mess up, insurance coverage for things, blah, blah,
Mhm.
blah. And that was interpreted by one of the state legislators saying that, well, you heard the doctor, all he's interested in is money. I'm
Right.
like, yeah, that's not what I said. But, yeah, you just got to keep in mind, that these are real families that you're
Mhm.
fighting for.
Yeah. Well, so the childhood obesity, one more question here, one more topic we wanted to jump on if you have a moment. Obesity is an epidemic in our country. We were interested in your thoughts on GLP-1s, some of the Ozempic and other weight loss medications. for use in adolescents and adults. Where do you stand on that? What are your thoughts on that?
That is such an interesting. Well, of course, I geek out on this stuff, Brian, because it's my zone. But like I said, I think I mentioned to you, I was on the writing group for the American Academy of
Hmm.
Pediatrics on the management of pediatric obesity. And so it's a clinical practice guideline, which is like our highest level of evidence support. And we went through our team actually and reported back all the findings from all these studies. And we looked at like 14,000 studies, and we called out about 90% of those didn't have adequate powering or adequate statistics. And then you finally get down to a group of about 450 articles that really powered this whole clinical practice guideline. When the when the information came back on the use of GLP-1s in adolescents and this sum total review, we were shocked. I would remember being in the room, and on some of the calls we're like, really? That's the results? That is like, because you read a study here and a study there, and you think like, okay, how does this all fit together? But when we got this summary result of like, this really works for kids in these circumstances, we're like, it's incumbent on you to get that message out, and it was not a popular message. I mean, there was a lot of people, and there's still a lot of people that just are not fans of that conclusion that was drawn. But for kids, when you make the decision based on health, I mean, these are kids. The book that I was telling you about that I'm working on right now, I was just writing about the comorbidities of obesity. And it's things like hypertension and left ventricular enlargement and high cholesterol and sleep apnea and all
Mm.
these things that kids get. And management of their obesity is what corrects those things. So we're not talking about doing this for for cosmetic reasons. We're talking about this because these are kids who are sick. These are kids who are getting type 2 diabetes at age 14. These are kids who are having sleep apnea at very young ages. So you take things like surgery and medications very, very seriously, but you do them because you're worried about their health.
Yeah.
So I think in the right setting with the right person prescribing them, again, like we were talking before, it should be done by people who are comfortable with the medications, with a lot of discussion, what it means, with a lot of, you never do them in isolation because, if kids quit eating, they'll get malnourished. If you give them GLP-1s, we all worry about their nutrition. And when people say, well, what's the long-term sequelae from this? I'm like, we don't know. We don't know. Anybody who tells you, 50 years, this is what will happen, they're making it up. We don't know. But what we're seeing is kids with type 2 diabetes now, and seeing kids with hypertension now, and kids who are dying with these complications in their 20s. So, it's kind of an urgent issue for our kids with severe obesity. Is it for everybody? Completely not. But is it for kids who have serious complications from obesity? Yeah, it is.
Oh, that's great news.
They're
Go
game
Miracle
changers.
Brook. Yeah.
Yeah,
What's another tool in the toolbox,
it
right?
is. Exactly. You don't do it in isolation. There's no, it's not a magic pill or magic shot. People feel that way sometimes with bariatric surgery. You get the surgery done. No, 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 no.
Yeah.
You have to, it's everything. And these families and patients who deal with obesity, it is really difficult. They've lived their entire life being told that they're lazy or that they don't have willpower or this or that. We know it's way more than that now. We know that. They have different food noise going on. They have different satiety cues. There's familial patterns. There's availability of food for exercise. There's all sorts of things that go into it. And so we just need more tools in the toolbox for it.
Hmm.
Unfortunately, now we have some.
Well, good stuff. Well, thank you so much. We covered a ton of topics, but one more thing before we let you go.
Sure.
We like to do a little fun lightning round with all of our guests. 5 quick
Okay.
questions, if you're up for that.
Sure.
Okay. Well, I tried to make them a little bit healthcare related, try to make them fun as well. So, all right. So if you are going to splurge on a meal or have a cheat day, what are you reaching for?
So I love Indian food. So I would probably go to Guru in Crescent Springs or Baba in Oakley and get, a big pile of Indian food.
Pile it on.
All the rice, carb it
Yeah.
up.
Sog mushroom. Yeah.
Ooh.
All right. If you could swap lives with a celebrity for one day, Who would it be?
Oh, I know this one. So I just listened to an audiobook with Nick Offerman and Megan Mullally, and I would be Nick Offerman because I want to live with Megan Mullally because I think she's hilarious.
She is hilarious.
Two is the greatest television character of all time from Parks and Rec.
Both of them are national treasures.
Yes.
My God. All right. What's the funniest question a kid has ever asked in your clinic?
Well, for those of you who, I have a gray beard, as you can tell, and dark hair. So I had an 11-year-old once. I was wrapping up a visit with him and I said, Chase, do you have any other questions before I leave? And he said, yeah, Dr. Bolling, I got one more question. He said, do you use product in your hair? I said, well, yeah, sometimes I do use gel. I do. He says, so I thought so because your beard is very different color than your hair. But dye my hair, Chase. This is just the way it happens. I'm not using just for men for my hair. This is just me.
Group formula.
Exactly. Shoe polish.
Well, he was intuitive, I mean.
I use product, not that kind of product.
All right. Would you rather run a marathon or bike a century ride, which is 100 miles?
I've actually done both.
Nice.
So I would pick the bike ride just because you get to see more stuff, less orthopedic issues.
Yeah.
So I would do the bike ride.
As long as you have a good bike.
Yes.
Right? You need
definitely.
good equipment. And lastly, if you were not a pediatrician, what specialty would you have pursued?
I think, I come from a family of applied scientists. They're all engineers, teachers, and healthcare. So I think I would have been a teacher. I think I probably would have been, and I really like kids. So I think I probably would have been an elementary or junior high teacher.
You kind of are a
You would have been a
teacher.
great one.
Oh, thank you. That's I keep them entertained try to keep them entertained for like 10 minutes. I had a group of like 10 Girl Scouts one time at the office. I was out of my bag of tricks in about 15 minutes. I'm like, let's go for a walk. I don't know what else to do with you.
Go for a walk.
Well, yeah. Dr. Chris Bolling, we sure appreciate you joining us today. Your insights are remarkable, and thank you so much for the time and all the work that you're doing to make our kids and, truly make America healthy again. You're actually doing that work, and we really appreciate that.
Thank you for what you guys are doing too. It's important to get the word out.
Thank you.
Thanks.
Well, thanks so much. Appreciate it.
My pleasure.
As you know, we like to end each full-length podcast with a call to action. If you care about keeping Kentucky families healthy, now's the time to act. Share this episode with a friend and join the conversation because your voice can help protect healthcare in the Commonwealth. Visit the Healthy Kentucky Home at www.ourhealthykentuckyhome.kentucky.gov. And there you'll find a myriad of resources available, which are designed to engage and inspire Kentuckians on a personal journey of achievable health and wellness improvements. Our Kentucky Home promotes simple, healthy lifestyle changes with a special focus on helpful and healthy wellness programs available to all Kentuckians throughout the Commonwealth.
Wow, that sounds like quite the program. As far as a call to action from my side, I'm just keeping an eye on protests and demonstrations and any kind of commercial shopping type of thing that people are doing, any boycotting, et cetera. There's some here and there. I've seen a lot of spontaneous demonstrations, like based around, for instance, ICE presence in a city or something, but nothing organized. From what I'm seeing from Indivisible and 5051 and some of the larger organizations, is a lot of planning to get ready for the 2026 midterms and all the activity there. And I think after the holidays in January, we're going to see a lot of action. So we'll keep everybody updated. And again, we just want to thank everybody for listening in. Our next full-length podcast will again focus on healthcare through a patient's perspective. And don't forget, you can join the conversation at our Facebook and Instagram pages or at blue.podcast.com. And if you like listening to our podcast, consider donating to help fund it, which you can do by clicking on the donate link at blue.podcast.com.
Absolutely. And until next time, stay curious, keep the facts in focus, and never stop fighting for what matters, everybody. Peace out.